Appreciate that.
Mhm.
You recently completed a certificate in health communication from Stanford. How has this training influenced your approach to health systems management and communication?
Thank you for the question. So, I think what I learned in that course is that health messaging is so important and so many aspects about health messaging. And there's a couple of things. It's like, firstly, identifying what do we need people? Who's the target audience? Who's this message for? What is the message? When do we need to deliver the message? Timing is important. Too early, sometimes people don't buy into it. They don't have enough of a frame of reference. Too late, misinformation has already set in. How do we deliver it? What are the correct channels, the correct mechanisms to communicate health messaging? Because how you do it for just the general public is different to how you will do it for health managers or health clinical professionals. And so these are the kinds of strategies I learned in the course, is that it's not just about, oh, we need to create awareness about unmet eye health needs. For who? When? Where? How? Is it going to be understood and received by the people we intended to? So yeah, it was delivered really well, short little videos and some didactic work, that and assignments. But that was my takeaway. It's, yes, we may be passionate about public health and want to educate people, but really thinking about the detail behind the who, what, where, when, and how is really critically important to making sure we hit the target that we intend, or the strategy that we want for that communication piece.
And before you were optometrist, you decided to pursue your bachelor's of optometry from University of KwaZulu Natal. Tell us about that thought process going into undergrad.
Interesting question, because I always say optometry chose me and I didn't choose optometry. Um, Again, I'm going to go back to just my growing up years. No role models. I was the first person in my family to get a university education. I just knew that I needed to go to university and study something. And coming from, shall I say, disadvantaged school, a school in what we call the townships, it wasn't necessarily well resourced. We had career guidance in our, timetable, but honestly, it was just free sessions. The teacher never pitched up 80% of the time. And so there was nobody really coming and talking to us about, these are your career options. This is how you apply to get into university, all of those things. This is what a bursary or a scholarship is. And so, as much as I was a high achiever in school, by the time I was in my final year of high school, I really didn't know what I wanted to do. I just knew I needed to go to university. I was in a science based stream in high school. So I knew I needed to do something in the sciences. I performed well in the sciences. And so I applied for, at the time, this is 19, late 19, no, mid 1990s. Believe it or not, I didn't even know what email was at the time. It was kind of just coming around. And so I applied just for a bachelor's of computer science, I think, because computers were all the rage, computer science. I had never seen a computer. There was no computers in our school. There was no computers at home, but computer science was the thing, right? This is the way the world was going. So long story short, was the first time in my life I ever failed. Those first 6 months of computer science at university, I bombed out. It was not sitting behind a PC and learning sort of coding language was not for me. And then I had to go back and reflect. What do I do with my life? I need to go back to university. And then I thought, okay, health sciences. I did well in biology. I kind of enjoyed the sciences. I want to have a meaningful profession where I help people. And so I just sort of blanket applied for health sciences. Didn't get in on first application, so did a general BSc. 2 years down the line, realized I'm doing this relatively difficult degree, Bachelor of Science in chemistry and biochemistry. But what am I going to be at the end of this degree? What job will I apply for? Ultimately, that was the goal, right? I had an economic objective as well. I need to get a job so I can build myself up, help my parents, blah, blah, blah. Anyway, applied again to all the health sciences, pharmacy, dentistry, occupational therapy. So I didn't actually have a stream. I knew what I wanted to do. And optometry was the first stream that gave me a placement. And I'm like, yes, I'm going to take it. It was extremely difficult to get in. They took 20 students a year or something. So I just grabbed the first. If pharmacy was, I probably would have been a pharmacist today, but it was meant for me to be an optometrist. And the profession has been phenomenal to me. Honestly, I've been so blessed. It's given me so many rich experiences and opportunities, but because I also took the opportunity, even though it wasn't something I selected, wasn't first choice on my list, it wasn't something I dreamed of being an optometrist, but I knew it gave me the platform to do something more, to make an impact in the world. And I ran with it. And I think because I did, I've also been rewarded in a sense with the kinds of career opportunities that I've enjoyed. And so, yeah, that's inadvertently, I ended up in optometry and I made good on the opportunity that was given to me.
I appreciate you also sharing that and being vulnerable in telling your the facts of your story, because many
Yeah.
people might think that that one failure is the failure, but it might be the thing that leads you to something more beautiful that you never knew existed. And in that, you're able to find yourself, kind of how we're going to get into now,